Good morning, everybody. Yesterday we had more than 95,000 people come forward for testing, which is a really good result. We need those high levels of testing to continue to make sure we're capturing all the cases of COVID, the Delta strain, in the community. To 8 p.m. last night, we had 170 cases in the community. Unfortunately, at least 42 of those were infectious for that time whilst in the community, and obviously that's the number we need to see come down. That is the number that we want to see come down in order for us to have that level of freedom that all of us are desperately wanting to have. Can I stress again, please do not leave your home unless you absolutely have to. Please do not have contact with any other household. Please. We're still seeing transmission in households and workplaces as the two main places. And given the numbers of infectious in the community, we are expecting to see those numbers bounce around. Obviously, today's number is considerably less than yesterday's, but don't assume that it won't be back up tomorrow, because whilst there are so many people infectious in the community, we expect to see those numbers bounce around. And what we do need is not just the stabilisation, but of course the numbers to go down. Can I please warn against anybody taking up illegal activity and protesting tomorrow? Your actions will hurt. Forget about the rest of us, but you could be taking the disease home and passing it on to your parents, your siblings, your brothers and sisters, or anybody you might have limited contact with in your workplace. Do not give those you love the most a death sentence. This Delta strain is contagious, it's deadly, and it's affecting people of all ages. But we also know in New South Wales that alongside these restrictions, our biggest weapon against the virus is vaccination. Can I please encourage everybody to come forward and get vaccinated? New South Wales has already administered just over 3.6 million jabs. We had a target of 10 million jabs. We're over a third of the way there. Come on, Greater Sydney. I'm calling upon everybody to come forward and get vaccinated. The advice on the AstraZeneca has changed, as you know, so anybody over 18 can come forward and get the vaccine. And of course, if you're already booked, please make sure you keep your booking. It's really, really important for us to get as many jabs in arms as possible, because more jabs in arms means more freedom for all of us. And the quicker we get vaccinated, the quicker we can live more freely. And of course, in National Cabinet today, I'll not only be fighting for more vaccines, but also calling for New South Wales to be given its proportion sooner, as soon as we can, so that we can get those jabs in arms. I don't want any issue of holding back on vaccines for months. If the vaccines are in Australia, I want New South Wales to get its share so we can get those jabs in arms, because that will help us not only in keeping people out of hospital, but also slowing the spread and having our chance at freedom. So I'm really pleased that we're more than a third of the way there, but we need to get to that 10 million for us to have a sense of real freedom. No matter what stage the case numbers are at, it's the vaccine that's going to allow us to live freely, and that is a fact. So the more jabs we get in arms, the more we can live freely and the more we can live confidently moving forward with the Delta strain that's taking over the world. And I just urge everybody to come forward. And with that, I'm very pleased to say that from the 9th of August, Kudos Bank Arena will be available for vaccinating our Year 12 students in those 8 local government areas of concern. So there's around 20,000 students, and we'll be getting them done in 5 days in that week. So from the Monday to the Friday, we'll be getting all those jabs in arms of those high school students doing Year 12 in those 8 local government areas of concern. And pleasingly, once we've jabbed the Year 12 students in that week, after that point, it will become another mass vaccination hub. We're setting these up all over the place. We've got our GPs up and running. We have the pharmacists up and running. And now we have the good health advice, which says anybody can come forward who's an adult to get the AstraZeneca vaccine. So come on, Greater Sydney. I'm really appealing to all of us for us to work together as a team. The more jabs in arms, the more we can have freedom. And that's certainly what we're aiming to do. So I'll ask Dr. Chant to give her health update, and then we will ask Commissioner Fuller to give an update as well. Thank you.
Thank you, Premier. So there were 172 cases of COVID reported in New South Wales in the 24 hours to last night. 170 were locally acquired and 2 were overseas acquired. There are currently 187 COVID cases admitted to hospital, with 58 people in intensive care, 24 of whom require ventilation. And I think this underscores the severity of COVID. It is critical that we continue to follow the health advice and work together to see these numbers drop. In terms of the key messages I'd like to convey today is to please get tested if you have COVID symptoms. And just to remind the community, they're cough, fever, headache, loss of taste and smells, sore throats, muscle aches and pains. Tragically, we've seen people present very late for care. When people present very late, we haven't got the opportunity to provide them with the great care that our health services can provide, and outcomes can be much poorer. So my key message is don't delay getting tested. Get tested, as with COVID you can deteriorate very quickly, and it is important you have that diagnosis and you're linked in to care. And just please never be fearful of coming to our health services for care. We have great health services and we provide incredibly good care. The other key message to echo and back the Premier: even one dose of the vaccine can reduce your risk of hospitalisation and death. We need to get those vaccines up. And whilst the ATAGI advice is for anyone over 18 to consider it, the group that really distresses me as well is the fact that we haven't got high levels of coverage or high enough levels of coverage in the elderly. Now, those elderly people are going to bear the brunt of COVID. And so for me, it's a no-brainer. There are increasing access points for AstraZeneca vaccine in the community. I would, any person who's got a loved one, I would pick up the phone, book them in with their consent, of course, but make those arrangements and support them to get vaccinated. The other message is, when we look at where transmission can continue to occur, even if we have people that are infectious of the community, if they've gone about their business in certain ways, they pose a lesser risk of transferring it to others and setting off those new chains of transmission. So the key message is shop deliberately, with purpose. Write a list before you go and get in and out. If you're going into those small grocery stores, butchers, bakers, be very clear, pause before you go in. And if there's a number of people inside, don't go inside, wait for those people to exit and wait outside. When you're picking up coffee or takeaway, preferably place your order and then wait outside. It is important that we minimise groupings of people, even if they're there in those stores at this time. So that's just another tip, because what we're trying to do is, even if we have people infectious in the community, make sure that you don't have the opportunity to have passed the virus on to others. Also, workplaces. I urge all workplaces to really review their COVID-safe practices. Think about those strategies of segregating staff. Make sure that mask wearing is absolute and correctly worn at all times, and make sure you maintain that physical distancing as much as possible in all the workplaces. We need to get on top of these transmissions that are occurring in these other settings if we're to see the numbers decline. Thank you.
Good morning, Premier. Ladies and gents, just reiterate the Premier's concerns is that please don't come into Sydney tomorrow to protest. If you do, you will be met by up to 1,000 police who will be ready to deal with you, whether that be via the health orders or other laws. We know that this is such an important time for New South Wales in terms of winning the battle against the virus, and coming into town to protest is not the answer. If you think you can splinter from that and protest somewhere else in Greater Sydney, that force will be mobile and will be waiting for you. You've been giving plenty of warnings. The strike force from last week's protest has locked up over 60 individuals and issued over 200 infringements, and that will continue. So if you turn up, you can expect the same sense of force. In terms of the 8 LGAs, we're seeing high levels of compliance this morning, lots of people wearing masks. just a reminder, if you live in the 8 LGAs, that you have to wear a mask if you're outside. It is more than just wearing a mask if you are indoors and out in public places. So thank you for the community. If you're going into the 8 LGAs, it's also a reminder that it is mandatory to wear masks. They're readily available, so we would ask people to understand the importance of wearing masks in the 8 LGAs of concern. As you all are well aware, last night I sought the assistance of the Australian Defence Force. The primary reason is because the compliance checks, particularly in the 8 LGAs, but not only, are well over 2,000 premises that we have to visit to make sure that people who have COVID or are close contacts are abiding by the health orders. Just an example this morning on a COVID compliance check, a young man who was COVID positive was out of the house and he had gone to work on a building site. Now, that sort of behaviour is exactly the reason why we need to have strong health orders that are backed by law enforcement and defence in terms of getting the highest levels of compliance that we can. One person could spread the virus through the job site. All those workers go home, spread it to their families. So again, just one example of why we need to ensure that those compliance checks are happening. But again, this morning we're seeing lots and lots of people wearing masks. We thank you for that. We still issued infringements overnight, over 300. Around half of those for people not wearing masks. That was across New South Wales, of course. But I think that one example is indicative of why we need to continue to really show strength in enforcing the health orders. Thank you.
Did you go and visit the building site, and has that been shut down now?
Look, that's just evolved probably half an hour before I walked into the press conference. But of course, there's a whole range of issues that stem from that. Police will be going to the job site urgently. We'll be working with health urgently in the contact tracing. But just an example of one person, the damage they can do to us coming out of lockdown.
Sorry, he knew he was positive.
And ADF personnel, are all police and ADF personnel that will be door knocking, are they vaccinated?
The New South Wales Police Force has over 10,000 people vaccinated. Not everyone who will be door knocking will be vaccinated, but they will have the proper PPE that is prescribed by health, which are masks that are a higher standard than the ones that we are wearing. So obviously their work health and safety applies to them equally. We're trying to, like everyone, is get our entire workforce vaccinated.
And the ADF, do you know, will they be vaccinated?
It is not mandatory, but it is mandatory that we apply a higher level of PPE than what would be in the community.
Is this an indication that he was positive?
Sorry?
This guy knew he was positive.
The information is from his family that he knew he was positive, yes.
Why has it taken... Compliance has been a problem for weeks. Why has it taken until now, or yesterday, to request that help from the Army, which has been on the table for more than 3 weeks?
Now, it's a good question. The sheer volume of increase over the last week has been enormous. So before that, certainly within the organisation, we felt comfortable that we're running hotel quarantine, we're doing covert compliance across the state, we're still providing safety for 8 million people. I think we're achieving a lot, but at the same time, exponential increase in COVID hits because the contact tracers have picked up so many close contacts, right? So the level of compliance has gone from hundreds into thousands, Alex, and for us, the Defence, we've been working together continually since the bushfires, right? They've been on the ground with New South Wales Police since the bushfires in 2019. People of the South Coast would have seen them, particularly through recovery. They're on the streets of Sydney every day with hotel quarantine. We used them early in the piece in COVID, doing compliance checks in inner Western Sydney. So it is not new to me, this relationship with Brigadier Mike Garraway and Defence. This is really just revisiting a strategy that we used in April, May last year.
With the strike force season that has been trying to track down protesters, the numbers that you've been quoting have been relatively stable with how many people you've tracked down over the past few days. Have you caught up with everyone you can from that protest, or do you expect more arrests from the original protest?
Yeah, there's still 3 individuals that exhibited violence that we are concerned about, and you have all shared the footage of them. Crime Stoppers wise, we're up to nearly 20,000 people have made contact with Crime Stoppers about the protest alone and had uploaded photos and names of people. And I just think on behalf of the people of New South Wales, we've got to chase every one of those down. And I think that's also important in terms of really putting a damper on people thinking they can come in on Saturday and behave like criminals.
Commissioner, regarding that, your Deputy Mal Lanyon said a couple of days ago the intelligence was there was consideration of a protest. Has that intelligence actually firmed up to give you information that there will be an attempt?
This has certainly been a new strategy in terms of the way that protesters are communicating with each other. They're using group chats and other forums. So it has been more complex to work out numbers, but it is a very similar type of an intel summary than what we saw leading up to last week. So from our perspective, we have to expect there's going to be a protest. It would appear not to be in the same numbers, but you could have 10, 20 people and be violent and it will still look untidy, and the people of New South Wales really, I think, spoke quite loudly, as did the Premier, in terms of that behaviour.
With regards to the deployment of the ADF, has there been any consultation with communities where there may be concern with high ethnic, Afghan, Iraqi citizens, etc.?
Not leading up to it, but certainly there will be. The defence won't really, from a boots perspective, hit the ground till late Monday, Tuesday. We'll be working with Multicultural New South Wales. Our multicultural liaison officers will be talking to communities. Can I just say that they will be focusing on contact tracing across Greater Metro Sydney, so you could expect to see them in the Shire or in the northern beaches or in the eastern suburbs. Now, yes, the sum of contact tracing at the moment is around the 8 LGAs, and we would understand why, but you could expect to see the 2 Blues and the military right across Greater Metro Sydney.
Can we just get you, just for the Commissioner, just quickly before you step down, your message to people, if you are COVID positive or if you are close contact, your message, what is it, you're going to get a knock on the door?
You're absolutely going to get a knock on the door, and if you're not home, we will take action against you, whether that is criminal or a $1,000 infringement. We will take action. And I think from a perspective of the damage that this will cause if people don't listen, I think it just puts us back into lockdown, and I think that's the key message. And I think we're supported by the community, taking strong action against people that aren't staying at home. Thank you.
If I could ask you a question about the protest, have any cases that you are aware of come from the protest from last week?
There's a couple of aspects. People may not be open that they actually attended the protest, so I'm not aware of any cases that have risen from the protest, but many people may not choose to disclose that. And can I just reinforce that health's clear priority, whilst police are stepping up those compliance activities, and we appreciate that. I don't think anyone wants the efforts undone because of the actions of a few. The vast majority of people, although, are compliant, and I think we need to make sure that we have that compliance activity particularly focused on those ones that are letting the team down. But I just want to acknowledge the community is doing a fantastic job, the vast majority of the community. In terms of the protest, we haven't seen any documented cases. However, I am aware that we are just following up one person to ascertain whether they actually had made it to the protest. Police did turn that person away and issued an infringement to them. We're just currently working with police operationally to locate that person and determine whether they actually did subsequently attend the protest. There will obviously be a public health response should that eventuate, but we are working hand in glove with police to resolve that issue. And that does highlight the message. Whilst I am a public health physician and I am totally committed to the fact that we need to have no tolerance for where people are flagrantly breaking the rules. This is too much a severe disease, too serious a situation to be in, to have people knowingly going out when they are positive. It just is so thoughtless, inconsiderate, and the impact on others so great. And we have no latitude with the Delta strain.
Sorry, just clarifying what you were saying there, sorry. So someone tried to attend the protest knowing they had COVID?
No, they didn't know they had COVID. We're aware that someone who had attempted to attend the protest has got COVID, has been subsequently diagnosed as having COVID after the day of the protest. So was infectious. If that person had have attended the protest, they would have been infectious. We are just working with police to ascertain whether that person did attend. The police indicated that they had turned the person around and that they'd given an infringement notice. So we're just working through those issues, but just in response to that question, as you know, I want to answer honestly, and it does feed into the risk associated with the protest. I mean, I just can't contemplate why people at this point in time would think that gathering together in a space, travelling on public transport from all parts of New South Wales would be in anyone's interest at the moment. And I'm sure our regional communities would not appreciate having COVID introduced through the thoughtless actions.
Dr. Chant, you may not be fessing up about having gone to it. Given the huge numbers that we've seen over the past few days, would you still be looking at the case numbers and thinking that there's a high chance that some of these numbers potentially they were contracting the disease at the protest?
We'll look at all aspects that could be driving it, but as I said, the intelligence I give you every day is the sort of areas where we're concerned. We've clearly seen some transmission associated with a number of shops in the Campsie vicinity, and as you know, there was action taken to close down the Campsie Mall. But what we're highlighting is to give people messages that they can act on. And the message I'm saying is when you go and pick up your coffee, and make sure that you don't walk into the shop until it's very less people are queuing. Queuing outdoors is much safer. Minimise your time in those stores and try and have all of the queuing and the waiting outdoors. And I am asking shops to actually think about how they do the service. Having someone actually take the orders at the front of the store so there's no contact if they can. I know a range of businesses have thought through those issues, but it is important everyone does their little bit so that if there happens to be an infectious person who's attended, they haven't actually posed a risk to any other customers or the staff getting infected.
Around mask wearing outdoors changed. So previously you've said that there was no need to wear masks outdoors. Now the people in these LDAs are wearing them. Has that advice changed now?
So the advice has changed from the point of view of facilitating compliance. So look, we have tried to balance the fact that people want to walk in a bush track when there's no one else there and not wear a mask. But for simplicity, and I think it is behones on all of us. I've always said wear a mask where you could cross over anyone and come into contact with anyone at all. And if it is easier to just put that mask on when you leave the premise, then do so. But in those local government areas, to make it very easy for police, that they don't have to use any discretion in terms of thinking about whether people would have crossed over, we've made it very clear. But my message to the community is masks are one line of defence. Please use them, but you need to do those other physical distancing strategies and other strategies as well to keep yourself safe. The Delta variant is much more transmissible, and so airborne transmission in small spaces is more predominant, and therefore being inside with an infectious case in a small confined area poses risk to you, and that's why we're suggesting that you spend as little as possible in the store and that you take the opportunity to wait outside.
Decontamination tents, if you like, on that street in Parkley where that disability care home was that was mentioned a couple of days ago. Is the situation on that particular street, has that got out of hand? Is it a particularly worrying outbreak there that a number of other houses where the infection may have spread to?
Not that I'm aware of, but I'm happy to follow up on that. That hasn't been brought to my attention.
Dr. Chant, can I just ask you what support you're giving families of COVID-positive patients? Is it family members who are not abiding by the rule to isolate as a close contact? Does health actually go to the house and explain to them what they have to do?
So there's a series of supports that have been put in place. So we have stood up the special health accommodation, which has been in place for a long time as part of our response, has stood up additional capacity. That is because many people in the area cannot effectively isolate, and so we have stood up capacity for and have a lot of contacts and cases in specific accommodation. And the advantage of that also is that those individuals can be provided with care and closely monitored. In terms of other cases, they are contacted and linked to care, and so each of the local health districts has a clinical care team that reaches out and checks on the welfare of individuals, follows them up clinically, and can link into the local emergency and management arrangements around other welfare considerations. So the response to cases and contacts is really a whole of government one, and I would actually like to reassure the community that if you have any issues, please raise them with the person who's calling you, because there is other supports available. So never hesitate in asking for help. We'd much rather you identify a need than feeling the need to pop out and get groceries. We can supply those groceries to you, and all of those supports are available to you.
Thank you. Supermarkets obviously have done quite well out of the pandemic. In the public health order, it says businesses must take reasonable steps to make sure people sign in via QR code on entry. There's many major supermarkets that are not doing that and people are just walking in. What's your message to those supermarkets?
Look, obviously supermarkets are absolutely crucial to the community, and I think most of the proprietors are doing the right thing, but I would say that I would ask each and every individual supermarket manager to make sure that there is somebody standing at the front if possible, and reminding people nicely that QR codes are part of what is now required to help our traces, but also to use the hand sanitation and so on, so that when they walk into the supermarket they're not likely to be spreading the virus. I think it's very difficult for supermarkets at the moment because there are very few shops that are open, and so people are going out to get their food. But I remind every individual, that every household, that preferably only one person from that household should go and get the essentials. I understand some people can do that weekly, others for financial reasons or other reasons might need to go out daily, but each one of those people when they walk into a supermarket are potentially bringing in the COVID virus. As we heard a little earlier, there was, there was one man who the police fortuitously stopped before he got to the demonstration. Maybe he still went to it. But if he got there, he was effectively carrying a deadly weapon. He was carrying the virus. So my message to anybody about going out anywhere, particularly to that demonstration, is you've got to be crackers to go to that demonstration tomorrow, because there'll be a lot of people potentially there with the deadly weapon, that is Delta virus.
Minister, we've spoken to a pharmacist in Cabramatta who's been doing a great job. He's got 300 AstraZeneca jabs into arms in 4 days. Mm-hmm. He's run out of supply now, and he has been told that his next supply drop will be sometime before August 13. Is there any way chemists can be getting more AstraZeneca? They're doing walk-in jabs. There's demand.
Let me make it very clear that the New South Wales government is absolutely thankful for the pharmacists who are out offering the vaccines to their local residents, and I think we would do everything we can to get more vaccine to them, but the bottom line here is the federal government needs to step up and give us more vaccine here in New South Wales. It is simply, I mean, the Premier made the point earlier, there's a certain allocation that they've talked about giving to us over the next few months. My strong message is that the vaccines are needed now, and we need to get them out. We're seeing a lot more people who are very willing to get the vaccines because they're seeing the horrors of what can happen in their community. And I want to say thank you to the pharmacists, thank you to the GPs, and thank you to all the frontline health staff, the New South Wales health staff. But we need more vaccines.
We've heard that there are 3 million unused AstraZeneca jabs in Australia. That was reported a couple of days ago. So is the federal government holding back vaccine?
The Premier is taking that message, as I heard her say earlier, to the National Cabinet today, so they'll work through those issues. but we want more vaccines, and we particularly want more Pfizer, but we'll have AstraZeneca, we'll have anything we can lay our hands on at the moment. Can I just say something else to the community more broadly? What hasn't been said today is that very sadly we are seeing more families coming in with a family member who is presenting not alive but dead. That is a terrible situation. What we're hearing is that some families, particularly in southwest Sydney and Western Sydney, are staying at home when they have symptoms and not coming out and getting tested. Can I say to those families, our government, the New South Wales government, is perhaps not like the governments that you have lived under overseas. We are here to support you, and our health system is here to support you. If you have any symptoms at all in a family member, come and get tested, and if somebody is sick, please bring them to our hospital, but preferably ring ahead and tell us that you're bringing that person in. We are there to help you. Our health system is there to help you. Don't sit at home and worry about the fact that you've done anything wrong. We want you to be looked after, and we will look after you. Our health system will look after you. So come forward, please.
Premier, how concerned are you that deploying the army in some of these parts of Sydney, where it's been discussed at length, some of the people who live there have fled war-torn areas, that this may backfire?
Oh, look, we're extremely sensitive about those issues, but please know we've been working with the ADF for the last 2 years, through the bushfires, through the floods. They've already been involved in the hotel quarantine system. They've been deployed in other parts of the state. So this is just an extension of our compliance efforts because, as the Police Commissioner said, we have literally thousands and thousands of close contacts. We can't afford to have at least one of them out there in the community in case they have the virus, because we know that 1 or 2 people infectious can cause a spiral or ripple effect, which causes a major setback. That's why I'm so strongly appealing to everybody, please don't go to the protest activity tomorrow. It's just going to prolong the pain for all of us. And if you don't care about all of us, that's okay, but you should surely care about your loved ones. Don't give them a death sentence by taking the virus home. And as we've seen, it's particularly affecting people who haven't had any doses of the vaccine. So I'm appealing to everybody, 1, do the right thing, but secondly, get vaccinated and get your loved ones vaccinated. We are going to use up every single vaccine we have. I'm going to, of course, again, renew my calls for providing us with our fair share ahead of time, because if there's doses in Australia, please give them to us in New South Wales. As I've said already, we've hit the 3.7 million jabs already. We need to get to 10. The quicker we get to 10 million, the freer we will all live, no matter what the case numbers are. The issue is that once a healthy proportion of the population has the vaccine, we can live more freely, and that is a message not just for people in New South Wales but for Australians. We can't continue to live in a bubble and not have our population vaccinated.
12 teachers.
Sorry, Lucy was first and then I'll go down.
Will Year 12 teachers also be able to get vaccinated as of the 9th of August? Will they also be vaccinated?
Well, there's nothing stopping teachers getting vaccinated now. We're calling on anybody over 18 years of age to come forward and get vaccinated. The AstraZeneca is available. I've had it. Lots of people have had it. I'm hearing quite well-known people in their 30s and 40s get the AstraZeneca. So I'm appealing to everybody to come forward and get the AstraZeneca. That's available now. And I hear that through our booking systems, it's only 2 or 3 days of waiting for the AstraZeneca jab. So if you book today, you're likely to get, some people are going in the next day and getting their jab. But if you go through the formal process, I'm hearing that it's about 3-day tops to wait for the AstraZeneca jab. So please come forward and get the jab. But of course, in the local government area, we're keen, in those 8 local government areas of concern, we're keen to get Year 12 a level of face-to-face from the 16th of August. And that's why I'm really pleased to say that Health's moved heaven and earth to get the Kudos Bank Arena available from the 9th of August, and during that week we'll be vaccinating around 19,000, I think it's 19,200 HSC students in those 8 local government areas, obviously of course across that week. And then after that time, that arena will be available to provide maximum AstraZeneca jabs every day, and we'll be able to deal with whoever wants to book into that system because the capacity is there. We're increasing our capacity every week. What I can't control is the number of doses we get, and I'll certainly be appealing through National Cabinet again today for us to be allocated. I understand that no other state wants to reallocate, and I understand what the view of National Cabinet is. I've heard that on a number of occasions, both formally and informally. However, there's no reason why we can't get an allocation ahead of time of what New South Wales' fair share is, because we need them now. The quicker we get to 10 million, and we're over a third of the way there. Like, can I just say, if everybody just takes on board, if each of us can call 5 people that we know that aren't vaccinated and tell them to get the jab, we'll get to that 10 million quick fast. And then ironically, we'll be the first state to have more freedoms. So this is the irony. The more jabs we get, the more free we can live. And I'm just appealing to everybody. We've had this sense of urgency for a long time in New South Wales. We think of ourselves as Australians as well as people from New South Wales. We want to live as freely as we can, and we'll have that opportunity the more people we get vaccinated.
In regards to schools outside of Year 12 students, there was some research released, I think, by the Commonwealth Bank this week that demonstrated some of the long-term damage through all the disruption to kids, even down to their earning potential later in life. Is there any way for younger children, Year 12 and below, to have even one day of some contact with teachers later in the month?
Oh, look, we're looking at all those opportunities. And what we don't want, though, is what would be more traumatic for students and families, is to have the virus keep spreading and for the lockdown to go on for a considerable period, which is what we absolutely do not want. So it's just the fair balance. Of course, we want to get kids back into school, all ages, but that depends on the best health advice, and it also depends on how many people we can get vaccinated in the next 4 weeks. So really, August is a month where I want everyone to come forward and get vaccinated. Please get the jab. Do your bit for our city, for our state, for our nation. Because if New South Wales can live freely, our nation can live freely. And I'll be pushing those targets that will be presented to us about how long it's going to take everyone to get vaccinated. If the vaccines are available in Australia, we need to get them into arms, not at a kind of organised pace, but with a sense of urgency. And that's what New South Wales is doing and will do. And I'm committed to that process. And please know, the only thing we can't control is when we get the doses and how many we get. But what we can do is support people getting those jabs in arms. And if pharmacists need more jabs, we'll make sure that happens. If GPs, we'll fight for the GPs who want more jabs and more GPs that want to come on board. And certainly we're doing a lot with our own mass vaccination hubs. I mean, our capacity has gone from about 60,000 a week through New South Wales Health, and we'll be getting around, up to 350,000 a week by the way we're going in terms of all the mass hubs we've got. And we also want to take the jabs out to the community. In southwestern Sydney and Western Sydney, we're going through community leaders to get the jab to them so they don't have to come to us. And so we're really keen to make sure we make those things happen, and I'll have further things to say about that next week.
But Premier, getting to that 10 million mark obviously requires regional New South Wales to be vaccinated as well. Aren't you taking Pfizer stock away from the regions and diverting it to Sydney? Well,
please know we have 100 sites in rural and regional New South Wales for jabs. We have a number of pharmacists coming online as well. And I urge everybody to come forward and get the vaccine. And in the whole scheme of things, it's only 20,000 first doses and 20,000 second doses that we're redirecting. So in the scheme of things, that's not a lot. It makes a difference to those Year 12 students. But in the scheme of things, it's not a lot to redirect. And we've had to be innovative because we've been told what we can't have. So what we need to do is make the most of what we do have and be smart about it, be quick about it, and make sure that we provide the support to our communities. But please know that that redirection is very small. It's touching the sides compared to the larger program we have. And I also want to thank our regions. Our regions have done so well keeping the virus out. They've had that level of freedom. Their kids are going to school every day. They're able to go around the community. Yes, there's some restrictions there, but compared to what we're going through in Greater Sydney, I think the regional communities have done an outstanding job. I thank them for their courtesy and their generosity, and I think they understand that they're just giving up for a short period of time, a small number of doses for a very short period of time, so that we can target those students that we're desperate to make sure they get through this very difficult period.
Indigenous people were put in the vulnerable category, early vaccination. How has New South Wales gone with its level of vaccination of Indigenous people, and will the redirection of Pfizer affect vaccinating young Indigenous people?
I'll ask Dr Chant to answer that question, and please know that the public health team has been focusing on our vulnerable communities in particular from day one, and I'll ask Dr Chant to answer that question.
So can I just acknowledge that the Commonwealth and the states have really identified Indigenous communities as being a high priority. There's been distribution of vaccine from the Commonwealth to a number of Aboriginal community controlled, and New South Wales has worked hand in glove with the AHNMRC and the Aboriginal community controlled in supporting them with the COVID response. I think it is through that partnership with community Again, I would urge anyone in any communities to get vaccinated. Please, now is the time that we do need to see those vaccination rates increased, and I'm particularly concerned that Aboriginal people Aboriginal and Torres Strait Islander people have a lot of significant underlying health conditions that will pose greater risk and threats should they get COVID. And so I really do urge anyone in the community to engage with your local AMS, Aboriginal Medical Controlled Health Service, engage with your GP, engage with your local pharmacy, whoever you like to access care from, and take up the opportunity to get vaccinated.
We've heard that people are presenting to hospital when it's too late. Why is that? Is it because people are scared that if they present to health authorities, they'll be taken away from their families?
Look, I think we haven't had the opportunity to explore the cases. I think I'm just struck by the tragedy of it, that we have had a number of people that have presented to hospital very severely unwell and sometimes dead. And I just think that people need to know that with COVID, you can deteriorate quite quickly. And just to really say that our health services are amongst the best, if not the best in the world, and that's probably a biased comment, but I genuinely believe it. We do provide good care. There should be no barriers to people seeking, ringing an ambulance, coming into healthcare, getting tested. We have great health resources, and so I just want to reassure the community that you will be treated with dignity and respect. Obviously, there will be some infection control procedures put around you to keep the staff safe, but we also will accommodate your needs and your wishes. So please do not have any hesitation in seeking care and testing.
Premier, we're hearing there's a
rapid antigen testing. Would you recommend or would you call on the TGA to approve self-use of those tests here in Australia? Because currently it's not permitted that way, but we're seeing that overseas in schools in the UK. Students are able to do their own antigen test at home, and that obviously saves time on a school's, draining on school resources. What would you recommend?
So obviously I would be keen that the TGA, like all appropriate bodies, looks at the evidence and looks at the local context. And I think at this time we want to use all tools available to us. So certainly I trust the TGA to consider the context, and there's also a number of other committees that are, such as the Public Health Laboratory Network, who are considering about the advice around how point of care can be used. There are also a lot of ways in which it can be done through remote supervision and other elements, and so I suppose it is also behove on regulators to look at all of the flexibility that can be embedded in their documents to allow its appropriate use.
Dr. Chant, how dangerous is it for police and army officers to be going to these houses if they're not vaccinated, if there are COVID positive people in those houses?
So the police and defence have strong occupational health and safety requirements. Clearly what we're wanting to do is ascertain that people are at home, and there will be procedures that have been put in place to ensure that the staff wear appropriate personal protective equipment and are distanced and don't actually enter the house. So we're not talking about police or defence personnel entering the house. What we're talking about is assurance that someone is actually home, and there will be precautions that people are wearing masks and distance. You don't need to be very close to the front door of a premise to actually identify, and I suspect they'll use technology. I'd defer to Commissioner Fuller.
You can see, given everything we've talked about with Delta, it's going to be pretty scary for them.
I think that there are organisations that have got a long, I think that when you think about the challenges that police and defence face, I believe that they're perfectly up for the task and follow strict procedures very well.
Last questions, please. Apparently there's a problem with at the moment with removalists. We're told like 95% or something are in these 8 LGAs, and people have to move house outside of them. Can there be any exemptions for them, or are you aware of that issue, and can anything be done to help people so they're not voiding their financial contracts and obligations with banks and settlements
Oh, look, I haven't heard of that challenge specifically, but I do know that there's provisions in place for people in exceptional circumstances to be undertaking that work. I don't know if that's not been raised with me specifically about specific problems or issues, but we are in a very serious stage. We want to get rid of the lockdown, we want to reduce the case numbers, and we just ask people to defer any activity which isn't essential in the next little while, and make sure that you stick to the rules and not leave home unless you absolutely have to. But we also have, on compassionate grounds, we know there'll always be exemptions. We know that people have various specific circumstances that need to be addressed, and they can seek assistance if that's the case. But the general message to the community is don't leave home unless you have to, don't do anything unless you have to, and make sure that when you do leave your home, you're following the strict rules, but also, more importantly, get vaccinated. I can't stress that enough. If you haven't had the vaccine, get yourself vaccinated. Go to your GP, your pharmacist, through New South Wales Health Hub. The more jabs we get into arms, the freer we'll be, and that's certainly something the New South Wales Government is focused on in the weeks ahead. Thank you, everybody. Thank you.